Welcome back. It is time to meet some startups. I hope you all got a nice cup of coffee or tea, spent some time on our networking platform, and are ready now to start this competition. Just to recap, every team has 5 minutes to pitch, and we will closely monitor the time, and the presenter will get an alert towards the end of the 5 minutes. Should they run over, I will be strict and end the pitch. After the pitch, our jury has 5 minutes as well to ask anything they want to know. So jury, get your notebooks ready. Don't forget the score right after the pitch. And presenters, move close to your microphone. Good luck. We are all cheering you on. Today, we start in Belgium. First up is Blyott. Using existing infrastructure, Blyott gives health organizations remote insights into their assets via a native app. That means no more searching, and so eliminating equipment surplus and reducing maintenance costs. Jerry Paulette will be presenting. Good luck, Jerry. It's over to you.
Good morning, everybody. Thank you, Annemarie, for the introduction. So my name is Jerry. I'm one of the co-founders of Blyott. And as Annemarie already indicated, in healthcare, there are many challenges. We focus on one particular one, namely make it easier for medical staff to retrieve their medical assets. Just to give you an idea, a typical hospital with 500 beds has over 5,000 moving assets, representing a total value of over 20 million euros. And as you can imagine, a lot of assets are either difficult to find or lost or even stolen. Our solution consists of 4 components: the Blyott sensors, inexpensive Bluetooth tags, which are fixed on the assets a hospital wants to track. Locators, these can be Wi-Fi access points with built-in Bluetooth. The Blyott cloud platform, this is where the magic happens, where all the data arrives and where the accurate position of an asset is being calculated. And then our REST APIs. Using these APIs, a hospital can, for instance, using their existing applications, see where an asset is in real time. Use cases: locating, where is an asset, also where is a patient; monitoring, for instance, what is the temperature in a refrigerator; Internet of Medical Things, more about that later; and learning, machine learning. As you can imagine, we are sitting on a lot of data. So we are using machine learning, for instance, to see how often certain assets are being used throughout a hospital. We have a very easy and transparent business model. On average, we charge hospitals €1 per month per asset they want to track and trace throughout the hospital. Main advantages of our solution: when the required infrastructure is in place, we can bring a hospital live in days compared to weeks or months of other solutions. And we are also working with the pay-as-you-grow model, make it very easy and inexpensive to start with our solution, again, compared with other solutions who very often have huge upfront costs. But the main advantage is, of course, big savings, happy staff. We did an ROI study last summer with the hospital where we prove that within 4 months, they had a return on investment using our solution. Milestones and strategy: the first hospital was launched in November last year. Currently, our solution is being deployed at 10 plus hospitals in Belgium and the Netherlands. Next year, we will expand in other European countries and also in another vertical, namely home and elderly care. We will also launch next year our first Internet of Medical Things device, working in exactly the same way and on exactly the same platform as the current offering. This Internet of Medical Things device is a bracelet that will allow a nurse not only to see where a patient is, but also to see in real time his health status. Why? Because it has built-in monitoring of 8 vital signs, including temperature and SpO2, especially important for COVID-19 monitoring of patients. We also recently closed a partnership with Blyott, one of the hottest startups in Silicon Valley, funded by companies like Amazon, Samsung, Qualcomm, and Alibaba. They are in the process of developing the first battery-free Bluetooth tag, which has a size and thickness of a postage stamp. Target price is less than 10 euro cents. Once this is launched, it will allow us to monitor not 5,000 assets in a typical hospital, but over 50,000 assets. Which brings me finally to the market potential in Europe. Depending on how you look at it, there are about 15 million beds in hospitals and home and elderly care, and about 1 billion moving assets, which we could track, representing a total annual revenue potential of over 5 billion euros. But the most important thing I would ask you to remember about my presentation today is that Blyott stands for big savings and happy staff in healthcare. Thank you very much for your attention.
Thank you so much, Jerry, and thank you for kicking off our pitching competition well within time, so my compliments. I would say let's move on to the jury and see if they have any questions. Who would like to start?
Hello, Iris here.
Hi, Iris.
Hi, hello. Thank you very much for the presentation. I have a short question. Will you focus on a specific hospitals? Because you mentioned that they will be paying €1 for every item to be tracked. So the question is, if it is a big hospital with many devices and many patients, is it cost effective?
Yeah, we did an ROE study this summer where we have shown, and this is valuable or valid also for small hospitals, that they have an ROE in about 3 months' time. So it's very cost efficient.
Okay, thank you.
Anyone else from the jury has a question for Jerry?
Yes, this is Antonio. Gary, I have a question related to your move to patients. Obviously, the problem of assets is a huge problem, but it's quite different to actually address the problems of, shall we say, helping the nurses to track patients. Why do you move in that direction, and how are you going to reconcile two completely different businesses?
It's not a completely different business because, first of all, we developed this whole solution together with the hospital, and it are the hospitals who are asking us to develop a solution, not only for tracking equipment, but also tracking patients. Patient flows identification becomes very important to see how long a patient has been, for instance, in the waiting room, surgery room, recovery room. That's the first thing. So the market is demanding us to develop this solution. And because we have the existing technology in place, for us, it's very easy to add some sensors to this bracelet that the patient is wearing, also to do some spot check monitoring. And again, these questions are coming from the hospitals. It's not something that we are trying to push to them.
Thank you.
Who can I switch over to right now for the jury for some questions?
Yeah, I have a question, a couple of questions actually. In terms of the cost savings, can you specify, for example, in the use case, what type of cost savings that you delivered in the hospital, for example? And for the second question, it will be regarding the competition. What's your sort of you are using artificial intelligence and etc. So what's your technological advantage in comparison to the competitors in the sense?
So first question, there are three levels where we can offer added value, bring added value. The first one is a typical hospital, 500 beds, as I indicated. They invest approximately €4,000 per piece of equipment, representing a total value of 20 million euros. There are studies, this is not new, that by implementing RTLS in a hospital, you can lower this total investment by a factor by 10 to 20% over a period of five years. So for a typical hospital, this alone represent a cost savings of, let's say, between 1 and 2 million euros. That's one thing. The second thing, and this is not really easy to quantify in money, is the time being saved by nurses. A typical hospital, 500 beds, has about a nursing staff of 1,000. Studies also indicate that using RTLS, you can save approximately 1 hour per nurse per month. Typical nurse cost in Europe is €45 all in per hour. So this also is a cost saving of a couple of millions a year. And then the third one is really about optimizing processes. A lot of time, for instance, is lost because there are hurdles in where the beds needs to start, etc. So it's trying to identify these hurdles to make the whole organization more efficient. And this in total, for the hospital we are working with, over 4 to 5 years will deliver a savings of over 10 million euros. So it's quite significant. Yeah.
We still
Second
have about
question regarding.
Oh, if you want to elaborate on that one, go ahead.
Well, there was still one question left. So, like I indicated in the presentation, the main advantages of our solution, it's really the fastness of the deployment. We can deploy very fast. And secondly, it's the low cost, starting at €1 per asset per month. We have taken a look at many other solutions before we decided to enter this market.
Quick question from Robert, I believe.
Yeah, hi, I just wanted to, if you could talk a little bit more about what application has been made so far of this in terms of hospitals, and also what kind of comfort you've gotten in that the pricing model works.
You have to be very quick because we are almost at the 5 minutes.
Yes, the model works, Robert, because we launched last year with the first hospital, and in less than 1 year, we have 10 hospitals using our solution. If you launch a very successful product in the market, the target always is, I heard from experts, 4 to 5 hospitals in the first year. So we are double. This proves our model works, our technology works.
Now.
And the use cases are different per hospital. It's about finding beds, pumps, but at the end, they want to track and trace everything.
Thank you.
Okay. Thank you so much, Jerry. Well done on your first pitch. And thank you, jury, for engaging and the questions as well. The jury now has some time to score this pitch before we move on to the next one. And of course, we heard about Blyott, who has developed a solution basically for healthcare institutions to find their stuff. And now they're working on solutions as well to find the patients and track how they're doing together with other sets of data. We're moving on from Belgium to Poland. Based on the analysis of more than 100,000 brain CT scans, the company Brainscan developed a CE certified system. This system, based on artificial intelligence, enables automatic detection and the classification of changes in CT examinations of the brain. Joining us is Dariusz Wisniewski. Dariusz, good luck.
Thank you so much. Thank you so much. Hello, I'm just waiting for my presentation. Oh, thank you so much. Okay, so as you heard, my name is Darek and I represent Brainscan AI, and we use it to classify and localize brain pathologies, but not just for the fun of it. We do it to reduce misdiagnosis. So I would like you to see this picture. So this is a CT scan, one slice of it. It's from a patient that was submitted to the ER, and he was put out of the hospital with some painkillers after a concussion, right? And this is his brain 4 hours after, when he unfortunately came back to the same hospital. The change, and it ended up with him being paralyzed from the waist down. So this is really sad and unfortunately really common. So you see what happened is the radiologist actually could have seen the pathological change happening in the first image, but he didn't, because it was a really small change. It was a gray dot in one contrast setting in a small space, and it was dark hours in the ER. So it was really hard for him to see that. And this happens a lot, actually. Almost 20% of all radiology interpretations are misdiagnosed. And that's a lot, right? And 60% of all CT scans are of the brain, which all of the brains have 20 plus common pathologies happening on them. There is also a shortage of radiologists. The last study shows that 16,000 radiologists are missing from the market, which puts pressure on the radiologists to do not quality, but quantity of the interpretations. So there is over 75 million CT scans of the brain in the US and the EU alone. And we believe that there are 50 million, which is 20% of that number, 50 million misdiagnosed and preventable cases that we could solve using our solution, which is Brainscan, which uses AI to analyze, classify, and localize brain pathologies. We have the CE2A mark for 5 types of bleeding, and as I believe right now, we have the best accuracy on the market right now, as far as the research that I've done preparing for this pitch. And we have probably the biggest privately owned data set on the market as well. And those 5 types of bleeding is just the beginning, because it's not the solution. The real solution would be a full AI triage, 20+ pathologies done by one software. So you don't have to have 5 or 6 different vendors, just one tool, powerful for the brain to see tumors, to see calcification, to see ischemia, to see all of those different pathologies. And we are not there. No, we're getting there. We need 1 more or 2 maybe years. This is actually the tree of our accuracy of the systems that we have in the place right now. Right, so we started 2017 and we had 10,000 patients with CT scan. We did our algorithms, as Amariette said before, 100,000, but right now we have over 300,000 patients with CT scans, and that's a lot. The system is pretty easy. The hospital does the CT on the patient, it goes to the cloud, AI Brainscan analyzes it and sends the additional information back to the radiologist where he can act upon it. The value for the patient is that the early detection is made possible and the diagnosis of his or her problems is possible. The healthcare system lowers the chances of misinterpretations, which lowers the hospitalization and the cost in general. And the radiologists have a tool that they can use to do their tough job. I'm not on this slide because I have my face on the last slide, so I'm going to talk about my colleagues. Robert Kitłowski, the CEO, he is a veteran entrepreneur and he is a certification expert. Marek Torjanowicz is an AI expert and owner of a software house. Szymon Korzekwa, a business developer and an PAX expert, and Adam Brzeski, university scholar and the best AI developer I know. We are right on track, right, doing our implementations in a teleradiology system right now, getting feedback from our clients. We also are talking with Siemens Healthineers. They are just waiting for us so they can implement our system into their whole system. The National Center of Research and Development of Poland gave us some money for R&D. We won a bunch of awards. One of it is Kaggle Gold, which we are really proud of, and a couple of smaller competitions all over the globe. Right now, we are seeking 2 million euros for the R&D and data sets and for the go-to-market strategy for Europe. We sell in a SaaS model.
And it is time, Darius. 5 minutes passed really quickly. I do realize that. Thank you for your pitch. Well done. Let's move on to the jury, who has the first question for Darius.
Antonio, I would like to ask Darius a bit more about the technology that you're using. Surely you are using deep learning technology. What are you using, and how elaborate are you on the use of it?
Yes, so I'm not the tech guy, but I will try my best to be as fair to this thing that I know. So the guys are using convolutional neural networks right now. I know that they are more advanced settings right now. We are looking into that. I know there was a research paper done like 2 or 3 weeks ago telling that convolutional neural networks are passé, but I'm reading that, but I don't understand it at all. Second of all, we are using natural language understanding algorithms to see and classify our database, which lets us segment the data, but make it in a smart way. So we don't segment the data on, if it says stroke, it means there is a stroke there. We actually developed algorithms to segment the data sets that we have, to have the ability to actually portion the data sets where it's less, so we don't have to go through each and every single one of the scans. Also, on the tech side, we used radiologists to do the etiketization of the data sets. So we have actually three techniques, supervised, unsupervised, semi-supervised learning to do all of this. So it's a combined effort.
Thank you.
2 questions. I see one from Iris, and then we go over to Oliver. So Iris, go ahead.
Hello, thank you. I have a short question, and it's about the business model. You mentioned that you will be, in some cases, partnering with companies like Siemens, Philips, etc. And so the question is, will you have an exclusive agreement with those companies, or do you have a business model that is open so you can partner with many different suppliers of the CTs?
Yes, so we want to be as open as possible. Actually, Siemens Healthiness is a partner that we have a letter of intent from their EU board of directors. But actually, I've been talking last year with the guys from GE, and they want the system as well. They just didn't send us the letter, so I didn't incorporate them that. But all of the partners know that we don't want to be partner specific. So we are open to collaborate with corporate partners, with teleradiological companies and hospitals selling door to door, as you say.
Okay, thank you.
Let's move to Oliver then, who also has a question.
Yes, thanks, Darius, for the presentation. Maybe a follow-on question with regards to what just was asked by Iris. So who's actually going to pay at the end for it? Is it then the radiology office or the hospital, or is it really your partner bringing the solution into the existing structures?
Yes, so the bill goes to the hospital. So basically, or the teleradiology company in a way. So, but in the end, the hospital actually pays our fee. So by doing the classification, we actually speed up a bit the process of the interpretation in many cases. So we can, by lowering by speeding up the process and make it more concise, we can generate savings for the hospital. So it's kind of a sell for them as well. And for the teleradiological companies, when they have an AI tool, they can have a bigger bandwidth to do so. So let's say that they have, if we incorporate our system as we are doing right now, and to the teleradiology system, we can portion which scans go first and which scans go later on, which makes the teleradiology company more competitive on the market. So they have the deals from the hospitals, and they then use their service, and we get paid in the end as well. If it goes for the Siemens, it goes like if Siemens sells CT scanners to the hospital, the Siemens tells them, hey, do you want Brainscan with that? And they go, hey, cool, let's do that. And then they give us a client, and then we just support the client on the tech side.
Okay.
Darius.
And do you perceive any adoption hurdles actually in the hospitals? Because the unmet need is clearly there. I think that's really clear. But in terms of spending money from a provider perspective now on a solution like that, is this perceived as a hurdle, also contract-wise maybe?
You have about 10 seconds, Darius.
So it's a hurdle, but mentally wise. So we need proof that it works and that it saves time, money, and it's cool. So what we are doing right now, partnering up with the teleradiology company, getting the data in so we can show why we are cool and why this works.
Well done. Thank you so much. That was the end of our Q&A for the jury, and we're slowly moving on to our third pitch, but not before summarizing Brainscan, who of course are working on a solution for one of the biggest issues in radiology, and that is misdiagnosis. Using an extensive data set and artificial intelligence, they make the lives and the work of radiologists a little easier, and so also improving patients' lives. We're moving on to our third contestant in these semifinals. AEDs, the automated external defibrillators, have to be on the spot and fully deployable at the time of an emergency. But in reality, only 70% of the AEDs are actually working. A lot of the others have been found deficient or dislocated. CardiLink ensures that installed AEDs from multiple manufacturers are ready to save lives. We've been joined by Lars Wasserman, and I'd say good luck, go ahead.
Thank you so much. Welcome everyone. My name is Lars. I am the founder of CardiLink. And this is Kenzie. Now Kenzie, he likes to play ice hockey, and this is a real life event. The story is being told by Kenzie's mother. Imagine an ice hockey stadium, two teams playing against each other. Kenzie's mother sitting in the stands. And she sees that Kenzie gets hit by the ice hockey puck in the chest. That triggers him to go into a sudden cardiac arrest. The child breaks down, lies on the ice. Fortunately enough, that ice hockey stadium they had a life-saving defibrillator. The defibrillator was brought to Kenzie, they undressed Kenzie's chest, they stuck the electrode pads, and then the device did not work. Just imagine what was going on in Kenzie's mother when she saw that. Now, sudden cardiac arrest is the most common source of deaths in Western societies. It happens 500,000 times in Europe alone every single year. A life-saving defibrillator could save 85% of those 500,000 people. What medical device industry doesn't like to tell you is that 30 to 40% of all public access installed defibrillators are not in working condition. We think that is a major scandal that nobody talks about, and that is where we step in as CardiLink. We ensure that AEDs, they work when they're needed. When Kenzie needed that AED, we want to make sure he gets it. And the best way to do that is connectivity. So we have developed an IoT platform that is able to remotely monitor the technical status of these AEDs. Our business model is explained easily. It is software as a service. Each device connecting to our platform pays a monthly subscription fee. So why is now the right time for such a model? Think about the corona pandemic. Think about curfews. Think about people not allowed to leave their homes. Why would you want to put at risk a human life and ask them to go out and check on the status of a defibrillator? We say, let technology do the hard work. Let people be safe. Further, the new medical device regulation is a driver for us because it mandates quality control. We as CardiLink, we are an enabler for that, and we are in a steadily growing market. CardiLink has the right team and enthusiastic people on board. Together, we make sure to deliver a good product to the customer. And as a founder, I'm especially proud that we have a strong and renowned advisory board backing our company. Our advisors have worked and are still working in some of the biggest names in the industry. And I am especially proud to say that all of our advisors have personally invested with their own money in CardiLink. Together, we are the only vendor-neutral solution in the market. Our main competitor is the make or buy decision by medical device manufacturers. We have proven that with CardiLink, medical device manufacturers are faster to market and they build upon an established technology. So, why am I here today? The graphics that you see here is actual revenue. This year, we are sitting at about 350,000 euros revenue, and we are in the process of tripling that again in the coming year. We have signed 5 manufacturers. We are established in 3 continents and have an installed base in over 20 countries. Now, here's the interesting thing and the opportunity for you. Customers are approaching us. Hey, Lars, can you with CardiLink, can you connect our fire extinguishers? Can you help us connect first aid kits? Can you help us make sure that medical devices, they work when they are needed? That is why I am presenting to you today. We want you to help us take what has made us successful with AEDs and commercialize it further. Today, we are making sure AEDs work when needed. Tomorrow, let us together make sure medical and safety devices work when they're needed. Kenzie, the ice hockey kid, he could be any of us. Next time somebody breaks down, let us together make sure to save them. Thank you very much.
Well done, Lars, and thank you too. Let's move over to our jury for the Q&A. Sophie, would you like to start? And could be that maybe your microphone is off because we're not hearing you. So maybe either our crew or Sophie herself can unmute the microphone. Otherwise, we'll move to Edith first, and then we'll move back to Sophie. So Edith, go ahead. Which I also cannot
Yes,
hear.
now I am here. So the question is, you mentioned that you are partnering with manufacturers. So the question is, what happens when you find a problem?
First line of support is the distributor in the country. Second line of support is the manufacturer. third line of support is CardiLink, but we notify you if something noteworthy happens. So if you don't hear from the system, you can rest assured all your devices are working.
Okay, okay, thank you.
And then we try Sophie again.
Yes, thank you. As I understand, well, you're moving, starting from an EID monitoring device and building an open ecosystem around it. You're moving towards more all kinds of health and safety devices. Am I correct?
That is correct.
Yeah. And I guess this is the point where the open ecosystem of all safety devices enlarges your market, because you said there's a huge market and you showed some numbers. But I wonder, which is the point where the growth is? Is it linked to the EAD or more to other safety and health devices?
The numbers that you saw is the AD business. So we have shown already we are successful and there are willing customers to pay for our solution. The bigger market is health and safety devices. And this is now where the customer demand is. So we want to take what has already made us successful, use a little bit of investment, and go to market in these other categories as well.
So this is where you will be using the EIT Health budget for, probably.
Exactly.
Yeah. Okay, thank you.
Roma and Robert have questions. So first go to Roma and then on to Robert.
Yeah, thank you. Very quick question. In terms of the go-to-market strategy, you know, and you see that your the clients are approaching, which is super good. But in terms of how you're going to approach the clients, what kind of strategies and channels are you going to use, and if they will be different for different sectors, let's say for health and then the safety devices? Thank you.
We strongly believe in collaboration. So we always try to partner with the manufacturers. We sell to the manufacturer lists us in their portfolio. And what happens when we do that, the manufacturer changes his business model. They go away from selling products and selling it based on a service. And that's what we enable with CardiLink.
And onwards to Robert for your question.
And then from a technical standpoint, you're getting certain information, I assume, from the AED and as to its status. When you expand that to other categories of health and safety devices, how are you going to get that same information as the status?
Well, part of the information is always the location. So the medical emergency services, they want to know where are these devices so that a first aider can go and get them. Second is we need to know that these devices are in working condition. So with a fire extinguisher, for example, there is a seal. And unless that seal is not broken, we can assume the fire extinguisher still works.
And then we're moving to Antonio.
Actually, I would like to elaborate on the previous question from Robert. The defibrillator problem is a very real problem and a very hard one.
Yeah.
And it's a very big total addressable market. Why are you considering to actually move to other categories when you can be the dominant player in a very large market? I don't follow it.
You're right. Our main focus is the AD business. We want to be as strong and grab as much of that market as possible. But at the same time, customers are coming to us and say, can you transfer your technology? And I would like to say yes to these customers.
Be careful.
A little bit of time for one additional question.
Sure.
Who would like to ask that one? Or is everything clear for the jury so far? I think that we rounded it up then. That was Lars Wasserman, ladies and gentlemen, from CardiLink. Thank you so much and good luck on hopefully making it to the finals. The jury are scoring this pitch for CardiLink, who has made a solution for one of the biggest problems out there. 85% of people can be saved or at least treated by an AED, but the AED has to work. Now, they found a solution to monitor the status of these AEDs and be sure that they are working properly when they are needed. We're moving on to Healthy Mind. Healthy Mind is a company specializing in innovative medical devices based on digital therapeutics. They offer healthcare facilities a medical device to alleviate the pain and anxiety of their hospitalized patients. Please welcome to our screen, Reda Quadra. Good luck.
Hello everyone. Good morning. Thank you for being here. My name is Reda and I'm the co-founder of Healthy Mind. a startup that combines neuroscience, clinical hypnosis, and virtual reality to alleviate pain and anxiety of patients. First, I would like to say that I'm very pleased to participate in this event and to share with all of you our vision and what we've been working on. I come from a family where pain is the norm. My parents suffer from chronic pain and they arrived at a point where even medication doesn't do a thing. When it all started, I was only a child. The only thing I could do was immerse myself in something that I love. And for me, that something was 3D modeling and animation, because I like to create immersive environments. Fast forward a few years, virtual reality is booming, a technology that can control senses, emotions, and cognition all at the same time. But what if we combine clinical hypnosis, a widely used technique for pain management, with the immersive power of virtual reality? And this is exactly what we did. We teamed up with strong medical and business experts to deliver a certified Class 1 medical device optimized to reduce pain and anxiety of patients. But does it really work? At the moment, our solution is used daily in more than 50 healthcare establishments for surgeries, painful procedures, and anxiety. We currently have 6 ongoing clinical studies and 2 published abstracts in international congresses. The first one, 57% of anxiety reduction. The second, 80% reduction of morphine consumption. In some cases, we're even able to replace general anesthesia with local anesthesia plus virtual reality, as you can see in this abdominoplasty on the screen. Our main targets are 5 medical departments: anesthesia, surgery, oncology, palliative care, and pediatrics. This represents a market of 195 million euros in France and more than $1 billion in Europe. We have 2 products, one stationary with a computer and fully mobile one. The stationary one costs 9,000 euros and the fully mobile one costs 6,000 euros. We have 5 main competitors that we meet regularly on the field. At Healthy Mind, we provide real-time monitoring and control of the experience even during the immersion. And our environments and immersion are 5 times more detailed than our closest competitor. Currently, we win 80% of our contracts, even if our price is twice higher. In 2019, our first year of commercialization, we sold in France, Switzerland, and Belgium, and we finished the year with 500K in gross revenue. In 2020, even with the pandemic crisis that blocked several months, we are able to maintain our gross revenue. And this shows that the tendency of the market is growing over time. In 2021, our plan is to tackle Germany and Netherlands, and something completely new, explore a new promising market segment that was born with the COVID. So good things can happen with the COVID. Many companies reached out to us to reduce the stress and risks of burnout of their employees. We have already sold the solution to 2 of the biggest companies in France that reordered more licenses a week after the initial purchase. The product that we have right now is just the start of a big journey. We are currently working on a much bigger project called Score Mind, based on neurofeedback and AI. With an EEG, we'll be able to calculate the pain and anxiety score of a patient and have environments that dynamically change depending on the state of that patient. With a financing of 1.6 million euros, our goal is to build the leading company in medical VR. But I would go even further and say that our goal is to build the leading company in neuroscience combined with deep tech and 3D. Thank you very much.
Well done, Reda, and congratulations on your pitch as well. Let's see, who from the jury has the first question for you? Robert?
Yeah, hi. Can you explain who pays, what the reimbursement model is, and why they pay?
Sorry, I didn't catch the question.
Sorry, who pays for the service, and how does it get paid, and why do they pay?
Yes. So who pay for the service? It's actually healthcare professionals. It's medical doctors that are actually in a hospital. So our clients is actually the budget. The budget is actually the budget from the hospital, but the users are healthcare professionals. And why they buy it? It's because actually the thing is that with our solution, it's completely new and innovative. So the only way that we had to create the market and actually see if it works is actually to give the solution to clients, to prospects. We actually lend them the solution for 2 to 3 weeks in our sales process, and they try it on real patients in surgeries, in painful procedures, and then they get back to us and they buy the solution because they saw the effectiveness by looking at it, basically. So this is actually the only way that we do it right now. We show, we don't really tell, we show with the Fed show, yeah.
Okay, and then we're moving to Antonio, who also has a question.
Really impressive number, 80% reduction in morphine. Chronic pain is 1% prevalence in the world. Totally different from surgery. You have plenty of competition in surgery, but in chronic pain, there's not a lot of players in this space. Can you elaborate on the price? Because honestly, 6,000 euros for a solution that is consumer oriented is pretty expensive. How do you want to change that?
So basically, our solution is not actually bought by the consumers. Of course, I do agree with you completely. If we actually go to the B2C market, our business model will completely change. It will be a lot more affordable for the patients. But right now, actually, we sell to hospitals and clinics. So the budget are actually in B2B. So this is why we are able to sell the product with a higher price. And then, of course, as I said, when we are going to target the B2C market, we're going to drop the prices and have it more affordable for the general people, because it is our end goal, of course.
Okay, and I see that Oliver also has a question.
Yeah, thank you. It's basically a related one, because I was also looking at the price tag, which is pretty high. My question is there probably a consumer version available soon? Because when you also talk about employers and stress management and things like that, I mean, you may all of a sudden enter a kind of a mass market, and then it might be better to have a product on the shelf that it's a little bit lower in price. Is there, or are you do you have any plans for that?
Yes, we do have actually a plan for that. So basically, for the B2B enterprise market, we are currently actually exploring the market, because we started doing that in the end of August, and we sold 5 licenses right now to 2 different clients. And the idea behind it is really actually to push and to try the solution for just stress situations, because in hospital we have actually pain and stress, but usually in enterprises we have actually just stress. So right now it is actually an A/B testing to try and see if the solution is actually effective for long stress periods. And then we actually go into work in R&D with our partners in medical, in neuroscience. We're going to work and see how our visual and auditory stimulus impact the brain of, for example, the employees. And then we're going to basically develop a new and innovative product for just the B2C market. Our goal is really to have a product that is used. And the problem with that in the B2C market is someone that can actually use the headset whenever he wants. So we have another problem that is boredom. Boredom, we didn't really check it for now. Right now, we are actually using it for healthcare professionals. So it's actually really standard care from 20 to 1 hour and a half. And it's just actually 1 session. But in B2C, it's completely different, because we can actually use it whatever we want. Yeah.
Mm-hmm.
Time for a quick last question.
Antonio again. I'll elaborate again on the comment from Oliver. Look, if you're going to measure chronic pain, and you are able to do it, which is a subjective area totally today in the world, basically you have a unique proposition for chronic pain, which is 1% prevalence all over the world. If you hammer your price, you have a unique solution for a big problem. So this is more a comment than a question, but I certainly think that you could be really even more interesting than
Thank you.
Just addressing the surgery.
And we
Thank
do
you.
have to end it with that as well.
yeah.
So thank you for that, Antonio. And Rena, well done. Congratulations on your
Thank
pitch.
you.
That was, of course, Healthy Mind, who are working on pain and anxiety alleviation through VR in combination with hypnotherapy.